Good afternoon, and thank you for tuning in to Think Tech. I'm your host, Attila Seress, and on our weekly show, Next Big Thing, we look for people who are doing interesting, important, and innovative things and give them a place to share it with the world. This week, we have Dr. Doug Haghighi. He's a Harvard dentist and a trained gastroenterologist in Alaska, and he's joining us via Skype to talk about his new product, Gutsy Chew. And hi, thanks for joining us. I think we have a little bit of a delay, but your product, Gutsy Chew, is it's a little bit different in terms of something that can ease stomach ailments, but it's a natural product, and it's a little bit different than what we've seen on the shelves so far. Now, I've seen a lot of commercials. I've seen a lot of commercials for different competing products, and you know, this one is a little bit different. So I think we're having some audio trouble. Can you hear me, Dr. Doug?
Oh, I can hear you. I got you now.
All right, perfect. So thanks for joining us from Alaska. And why don't you tell me a little bit about this product?
And went out again.
Well, good thing you're not an ear, nose, and throat doctor. So, but I can definitely hear you. So why don't you tell me the story of the product and how you came up with it?
So I think you asked, you know, the story of Gutsy. You know, I'm a gastroenterologist now. I was a former dentist. And I have an adage in life, you don't have to be sick to get better. And I kept hearing from patients that certain products, natural remedies, helped heartburn. And I said, you know, there had to be.
Oh, we seem to be having an internet connection problem here.
Oh, can you hear me now?
There you are. You're back.
Yeah.
Hey, that's part of being a global show. Sometimes the internet cuts out. Well, you were saying how there were some natural products that seem to do the trick a little bit better than some of the over-the-counter stuff. I think he agrees with me. Well, let's try to reconnect via Skype. But in the meanwhile, you know, I'm going to read you a little bit about what his product is all about, and you know, we can see what we can see if we can reconnect in the meanwhile. Oh, there we go. Looks like it's coming online there. But you know, part of you know, I know me personally. You know, I'm a big fan of that product, Airborne. I'm sure many of you are too. It's that thing that comes in the tube, and you put it in a glass of water and kind of fizzes up. Well, I like those kind of things. So you know, I get really excited about herbal remedies. You know, and in general, I believe in our society we're kind of you know, we're kind of a subject of packaging. I'll give you a perfect example. Have you ever been to say a Costco or a Sam's Club and seen those giant jugs of lemonade? You know, the instant stuff. So you take that powder, right, and you pour it inside of a jug of water, and then you mix it up, and then you have lemonade, right? Well, did you know that you can actually make lemonade with lemon juice, sugar, and water, and just put it together? It's the same action, it's the same everything, but I think as a society we've been kind of you know, conditioned to want the prepackaged, pre-processed thing, and then go through the same motion in creating it, or same amount of energy creating it as it would normally take to make the original product that it was based on. So why not make lemonade? And I believe that the Gutsy Chew product may be the right fit for something like this. But you know, we're gonna go to a quick break here, and we're going to see if we can reconnect with Dr. Doug and talk more about his product. So stay tuned. We'll be right back after this break.
Hello, I'm Martin Despang, and I'm the host together with the one and only Ali Amashta, and our show is called Urban Transcendence. And Urban Transcendence is about identifying where we have a unique situation of a vibrant city in one of the most beautiful natural environments. So how these two can coincide, sometimes conflict, how they could find reciprocity in the 21st century is what we're excited about. And we're planning on bringing in a diverse body of guests, both from the arts and the science and the established and the wise and the emerging generation. So hope you will join us. We'll always be on Thursdays from 1 to 2 p.m. Thank you very much. Hello,
I'm Jay Fidel. That's Sharon Moriwaki of the Hawaii Energy Policy Forum. And every Wednesday we have Hawaii, the state of clean energy. We've been doing it for some time now, and we have some fantastic guests on there, unbelievable guests who give us insight into what is going on in a very complex, sometimes very confusing, sometimes very disappointing area of progress in the state. So we love doing this. We love meeting them. We love talking to them. We love having their ideas out on the table. So maybe, just maybe, we can all make some sense of what's going on. Sharon, what do you think?
I think that's absolutely correct. We enjoy ourselves meeting with all these people and hearing about the energy and the state of clean energy, and hopefully we advance clean energy for the state. So it's terrific. Join us.
Okay, it's every Wednesday. Okay, Wednesday is Energy Day. Every Wednesday, 4 to 5 p.m. Hawaii, the state of clean energy, here on Think Tech Hawaii. We'll see you there.
Hi, my name is Dr. Rafi. Every week, I'm right here at Think Tech Hawaii, 3 p.m. on Mondays. My show is Boris' Bio Briefings. What do we do here? Well, we watch sperm swim. We see if they catch anybody. We check out the latest biosimilars. You know, the kind that, what was his name? The guy with the bicycle? I guess we forgot his name, but he was taking EPO and other human growth factors. We'll be talking about human growth factors. You want to know where to get some? Maybe I'll tell. Anyway, you can catch me, as I said, every week right here, Monday, 3 p.m., Think Tech Hawaii, Dr. Rafi. You can also find me on Twitter, BioInfo Medical. Or you can catch me on Facebook, Dr. Rafael Boritzer. I'll be happy to converse with you. Aloha. Hi.
I'm Jay Fidel. That's Sharon Moriwaki of the Hawaii Energy Policy Forum. And every Wednesday we have Hawaii, the state of clean energy. We've been doing it for some time now, and we have some fantastic guests on there, unbelievable guests who give us insight into what is going on in a very complex, sometimes very confusing, sometimes very disappointing area of progress in the state. So we love doing this. We love meeting them. We love talking to them. We love having their ideas out on the table. So maybe, just maybe, we can all make some sense of what's going on. Sharon, what do you think?
I think that's absolutely correct. We enjoy ourselves meeting with all these people and hearing about the energy and the state of clean energy, and hopefully we advance clean energy for the state. So it's terrific. Join us.
Okay, it's every Wednesday. Okay, Wednesday is Energy Day. Every Wednesday, 4 to 5 p.m. Hawaii, the state of clean energy, here on Think Tech Hawaii. We'll see you there.
On our show, Next Big Thing, we give people who are doing interesting, important, and innovative things a place to share them with the world. Thank you so much for tuning in live, and of course, thank you for watching our videos on YouTube. With us today is Dr. Doug Haghighi, and we're talking about his new product called Gutsy Chew. Gutsy Chew is a natural product that appears to solve digestive problems without having to go through a really extraneous process. So he's with us live, and he's with us from Alaska. We were earlier trying to get in touch with him, but I guess he was too close to the Russian border, and the internet cut out. So thanks for coming back online, Dr. Doug, and why don't you tell us the story of this product and what inspired you to make it?
Well, I have an adage, you don't have to be sick to get better. And I try to incorporate this in my life, in my practice. I'm a gastroenterologist, former dentist. I kept hearing from patients that certain natural remedies helped heartburn, indigestion, sour stomach, and so forth. So I said there had to be something to this. We did a fair amount of research. I came up with a proprietary formula of apple cider vinegar, licorice root, and papaya. And I wanted to put science behind it because there's not a lot out there in the natural realm that has science behind it. We did a double-blind, placebo-controlled trial with our proprietary formula and had positive results for decreasing heartburn and a trend towards decreasing nausea and abdominal pain. Now, as I mentioned, I'm a former dentist and I had to be true to my dental roots. So we added xylitol to help decrease tooth decay and optimize oral health. We've also added calcium and magnesium. So at the end of the day, you have an oral and digestive supplement that knocks down that queasy, uneasy after eating feeling, along with what I call gut burn and gut bloat.
Now that sounds great, but I've had a pregnant wife with a couple kids before, and I'll tell you, there's special drugs out there to also make your stomach feel better when you're going through that. And can this be used for cancer patients or cancer treatment or anyone who's going through a pregnancy who's having to deal with nausea or upset stomach?
So speaking to the cancer patients, certainly with regard to pregnancy, that's one that we really we defer to the primary obstetrician, just because I wanted to put science behind it, and we really couldn't do a double-blind controlled trial with a pregnant woman. So we defer to the obstetrician there. And the key here, I think, in generally in medicine, is trying to achieve the maximal therapeutic effect with the minimal amount of intervention. And in some people, that may be taking the more traditional, what are called proton pump inhibitors, which have several side effects. It may be taking over-the-counter medications or a natural remedy. And what we've developed here is something that is all natural. It has no preservatives, and it has a nice effect.
I hear the word natural quite a bit. Why don't you tell me what's the difference between a natural product and something that's an over-the-counter or packaged product that you'd find at your drugstore?
So great question. So if you went to Walgreens, for example, I've been on Hawaii, there's different drugstores and so forth, and if you look on the back of a Tums, for example, there's aluminum, other preservatives, other artificial coloring. Gutsy Chewy is all natural, and we've gone through rigorous trials to make sure that this is the case, because that's what I kept hearing as a buzzword from my patients. We wanted something that came from the earth, was green, and did the right thing. And that's what we've achieved.
Well, why would a manufacturer put something like aluminum into their product? I mean, that by definition, wouldn't that cause some problems for people?
Well, you can't single out this product versus that product with regard to certain small ingredients, but you don't know the long-term effect of things. Plastic bottles. There's been data out on long-term use of different things, but the goal was to keep this product clean, and that's what Gutsy Products offers: a clean, natural product to achieve a nice therapeutic effect. Again, what we call decreasing gut burn and gut bloat.
Now, do you have one there? Maybe you can hold up to the camera that we can see.
You know what? If you just hold on 1 second, I have one right. Yep,
okay,
right here.
Great. Yeah. Now, wow, look at that.
If you're familiar with the Airborne,
I'm a big fan of Airborne, I'll tell you.
It's the same manufacturer, and it comes in a tubal case. It's not an effervescent. It's a chewable, and we have two flavors: wild berry and citrus. And another goal here was to get it tasting where people would have enjoy taking them. And I think for the most part, when people have taken them, we've had very good feedback with regard to taste, and that's obviously very important, as I mentioned.
Now, there's some other interactions that maybe you want to talk about. You were talking about enhancing the body's natural defense memechanism. Now, let's talk about this versus other products, because I've seen a lot of products on television that advertise. They have some big name stars, and they advertise a lot of or they have a lot of the same claims that you do here. And obviously, a natural remedy, and when you're sick and you're not feeling good, sometimes you don't care so much if it's a natural remedy or not. So let's talk about those differences.
So the so-called proton pump inhibitors, Prilosec and Nextins of the world, are the most commonly prescribed medications for heartburn and digestion. They've been out for 25 years. I prescribe them, frequently as a gastroenterologist, only when they're indicated. Classically, they've got some side effects of abdominal pain, diarrhea, and headache. However, over the last couple of years, it's come to light that they decrease calcium and magnesium absorption, as well as B12 absorption as well. That these can lead to very serious medical problems. They've also been associated with pneumonias, as well as a certain Clostridium-type difficile diarrhea. So what I'm getting at is that my product in particular, when you juxtapose to these, has very minimal side effects. The proprietary formula, we've had toxicologists look at this, and it is well accepted, well within the range of safety.
Now, why don't you tell me about the history of some of this stuff? Because if I remember right, I read something about how we didn't really have any sort of medications or anything that addresses heartburn needs until maybe about 20 years ago. And you know, what did people do before then? Why did this come about? Were you part of that revolution?
Well, I'm not that old, Attila, I must say, although my hairline would suggest that. But to be honest with you, the beauty of our proprietary formula compared to what's been out lately is that really nobody knows the exact mechanism. I mean, for example, apple cider vinegar is acidic, but it actually helps with decreasing heartburn and bloating and so forth. Papaya, again, if you look at through the centuries what it's done, everybody knows it can help with digestive health or making you feel better, but nobody knows the exact mechanism, as is the case with licorice root. People say it has a nice soothing effect on the gastrointestinal tract. However, we're not quite sure exactly what it does. We know that it works. And again, that was the genesis to this idea. I kept hearing from patients certain things worked, and that's what led to the idea.
So my question is, since you're in Alaska, where do you get papayas from there? Do they grow on trees in the snow?
Well, no. Like I said, I'd like to say that the product's made in America. It's made in Minnesota, and it's shipped out of Kansas City. But yeah, there's no papayas here in Alaska, unfortunately. No.
Now, why are you in Alaska, if you don't mind me asking?
Well, I'm originally from Ohio. I trained at Harvard Dental School. I was going to be an oral surgeon. I finished up my medical degree at Case Western Reserve University. I'm boarded in internal medicine. I then went to the Cleveland Clinic and subspecialized in gastroenterology. I served as chief fellow there in 2005 and 2004, 2005. I was in private practice, and to be honest, me and my wife, we were looking around. We saw a nice opportunity here in Alaska, and the rest is history.
What was that opportunity in Alaska?
Well, we were looking for another job. I was just looking around, and friends of a friend said, hey, a particular group in Alaska was looking for a gastroenterologist. We flew up here. We fell in love with the place, and like I said, I've been practicing here now almost 7 years.
Wow. So are you planning on staying in Alaska, or as this product takes off, you're going to have to go on a road show to promote it?
Well, I do travel for it, that's for sure. But I tell you, Alaska, once it gets in your blood, it's certainly stays with you. Like, we do head to our sister state of Hawaii every Thanksgiving and maybe in the winter, because that's about a 5-hour flight, and that's one of my favorite flights. But I tell you what, I think I'm an Alaskan right now.
You're an Alaskan. You're likely to stay there. Well, so what is the, how do people get this product? How do they get this Gutsy Chew product?
So the best place to get it is online at gutsyproducts.com. You can also follow us on Twitter at Gutsy Products and on Facebook, and we frequently update these sites with news and notes concerning digestive health pretty regularly, and it's a very nice follow. What at Gutsy Products, news and notes, and anytime I find something interesting or I think that will enhance digestive health, I try to get it out there. And we do this, like I said, pretty frequently. But gutsyproducts.com is the best place to go to look at our product. You can see more about our story. And like I said, we frequently update the website, the Facebook, and the Twitter page with interesting news and notes about digestive disease.
Wow, that's very interesting. So gutsyproducts.com is the website. Your Twitter handle is at gutsyproducts.
At Gutsy Products.
And should we be expecting this product to be in a major retailer sometime soon?
We're always talking to folks. What I like to say is do the Gutsy challenge. If there's something, if you go to Cheeseburgers in Paradise, there in Honolulu, have a big old cheeseburger, and it gives you a little bit of indigestion afterwards, take one of these. It will work. It will work. In our study, about 15 to 20 minutes, people felt great. And like I say, I wouldn't be selling it if I wasn't putting my name behind it if I didn't think it worked. And I just tell folks, do the Gutsy challenge. try something and then pop one of these things, you'll feel, you get rid of that after eating gut burn and gut bloat, and you get gut good.
Well, and you know, if we're in Alaska, we can always take the challenge after eating one of those big Alaskan crabs, right?
Oh, well, yes, that's wonderful, with little melted butter. Absolutely.
A lot
Absolutely.
of melted butter. Oh, that's some good stuff. All right, we get some
Yes,
crustaceans
sir.
in our system. So yeah, I mean that's really it. I mean that's the most important thing, right? You can go out and eat whatever you like. Just have the right tools in your belt so that you can keep on functioning afterwards.
And that being said, I always preach, because one of the biggest problems from a public health standpoint we have is one of being overweight and obesity. And actually a primary lifestyle modification to prevent indigestion and reflux is losing weight. And I often reinforce this to my patients, because that's that's one of the only scientifically proven lifestyle modifications is losing weight to help with reflux. And as you know, our society as a whole is just getting a little plumper.
Well, how about you know, waiting a few hours after you eat and then going to bed? I know a lot of people, they get home late, they scarf down some dinner at 9 o'clock and go to bed at 10. Is that good for you?
Hello?
Yeah, I think we lost you there. Well, that's all right.
No, you got me?
Just we'll wrap up the show. So for more information, go to gutsyproducts.com, and of course, if you want to get in touch with Dr. Doug, all his contact information is there. Thank you, Doug, for joining us here on Think Tech, and stay warm there in Alaska, and have some gutsy chew there, and of course, we're going to have more next big thing right after this break, and stay tuned. Aloha.